Ah, they got you too, huh? Well, since you're here, welcome to the Paddy Wagon. Us two Irish-American buddies drink, bullshit, discuss fun topics, and sometimes have an interesting guest such as yourself to talk with. So pull that flat cap back on, grab a drink, and have a seat. This is the Paddy Wagon.
Welcome into the Paddy Wagon. Today on the Paddy Wagon, Mike and I will be looking for a clean bill of health from our new friend, our new physician, Dr. Zain Hakeem. Dr. Zain is an Austin-based physician who is looking to change the core values of how we approach health and wellness, which is a real shame. Mike here, I think, tell me if I'm wrong, but I feel like you were hoping someone was going to be giving you a reason to turn and cough today.
That's why I'm here. Is that not going down? Thanks.
I don't think this time, buddy.
All right, fair enough. I'll do it myself.
All right. Well, Dr. Zain, welcome to the show. Why don't you let us know a little bit about yourself?
Yeah, thanks for having me. What to say? I'm based out of Austin, Texas right now, born and raised in Baton Rouge, Louisiana. Yeah, just trying to
roll tide.
I don't think that's...
Sorry, I had to.
That might, yeah.
Oh God.
It's funny enough.
Excuse my friend.
No, it's funny enough you say that because like people try to say, "Oh, go Tigers" or like whatever, and I'm like, dude,
right.
When I was there at LSU, all I remember is the library. Like, so I was busy, so my experience is very different.
Good, nice.
Understandable.
Oh, that's awesome. Yeah, my wife's a huge football fan. Her dad was in the Air Force, so all over the South. She lived in Alabama for a long time. So now we, by default, here in Pittsburgh, we love to watch Alabama football. So anyway,
it's a big deal, but I'm too much of a nerd. So
too much of a nerd, and in that library.
Woo, me too.
Yes,
right.
there's your nerd. We're actually all a little nerdy on this show, which is kind of the deal. So. Dr. Hakeem, what are you drinking with us today?
I got a couple things here. I got my Core Power Elite Chocolate Protein Shake with 42 grams of protein to mitigate my weightlifting, and I got an Athletic non-alcoholic IPA. So,
fantastic. Yeah. On that note, I'm going to reference something that you just said.
Yes.
Before, we had talked about something previously where I mentioned chocolate milk. I would want to drink chocolate milk after I worked out.
Best.
Do you remember that conversation?
Yes.
And I said it was good for after workouts. I said a lot of the gym rats would drink chocolate milk. And I feel like I remember you looking at me like I was crazy.
Mm-hmm.
Yeah?
I did.
And listen to what he's drinking. Protein, little chocolate milk kind of thing going on there.
It does taste like chocolate milk, actually.
I'm onto something.
It's pretty good.
Yeah. Actually, doctor, since we have you, what is the reason that makes such an excellent after workout drink that a lot of people crave?
Yeah, so I think there's a lot of reasons. Number one, after a heavy workout, you're just calorie depleted, and so I think liquid calories, fat and sugar.
Mm-hmm.
And then I think for old school bodybuilding, the belief was that rapid sugar intake would trigger some insulin, and insulin helps muscle growth. I think more recently, the emphasis of protein, there's not much more you can do to hack muscle growth other than giving protein and lifting heavy enough. So,
okay.
But that was the original thought.
So again, like always, Mike, you're old school.
I'm old school.
All right. That's an old school way of thinking.
Thanks.
Right.
Is this an age thing? Is that where we're going with this again? All right. I got you.
It's usually where I like to take it.
Nice. Well, I'm trying a new beverage. First time here for me, Sexton Irish whiskey. And I'm going to give it a sip here. It's a new one. I've never tried it. So we'll see how this goes. It's good. There's something that I'm going to get back to us on here. There's a taste. It's not a bad taste.
It's a weird after fight.
No, it's one of those things you taste the flavor and you can't quite figure out what it is, but you know you've had it before. So I'll get back to you.
Is it leather notes?
Is it leather notes? It's a leather note. It tastes like an old book.
An old shoe.
Yeah. What are you having, bud?
I've gone back to the Slane Irish whiskey, which was interesting. I forgot I had some people over recently, and we were enjoying it, and so I know I've only had like 2 glasses out of this bottle, and then I picked it up to pour myself one for today as we're recording, and I went, "What? Oh wow, this bottle's suddenly light." But yeah, no, that's what I'm sipping on today as some of the flame.
All right, perfect.
And it's a decent whiskey. I enjoy it.
Good.
Now that we've gotten that all the way. So I just want to say we've talked about this a lot. We send out our guest intake form, you fill it out, you tell us a little about yourself. You had one of the best tell us about yourself sections in any guest form. As far as terms of should I need to Google? Because look, bon vivant.
Mm-hmm.
I'm pretty sure.
Not bad. Pronunciation sounded good.
Yeah, that's right.
Hey boy.
This
4
next
years
one.
of French.
There
right?
you go. I
4
want to
years
hear
of
the
French
next
right here,
one.
all right? High school coming back. Is it Sybarite?
Sybarite.
Yeah.
Sybarite.
See, there you go.
Sybarite.
There you go. It's basically some bougie ass way of saying my ass is bougie is what I detect there.
It's for sure the case. Yeah.
I love it.
It was actually a quote or a reference to a quote. So there's one of my favorite characters, Jubal Harshaw, in a book called Stranger in a Strange Land, who is a doctor, but describes the description is let me see if I can get this right. Bon vivant, gourmet, sybarite, popular author extraordinary, neo-pessimist philosopher, devout agnostic, professional clown, amateur subversive, and parasite by choice. And so that's his original introduction in the book. I've always loved that.
It's a great introduction.
Yeah. That's so good.
I like it. I like it.
Let's get you're bougie. I think Mike and I are both a little bit bougie at times.
Very bougie. Yeah.
I seriously think like at times I'm a total food and drink snob. I really am. I like to when I'm going out somewhere, I like to go to a very bougie upscale restaurant that, I want to take my wife out or just so at my work and with some friends outside work, we have a book club that I've talked about on the show. But after our book club started, another book club at my work also started, and they started calling themselves the Spicy Book Club because they were reading, very romance novel stuff pretty much only, whereas we kind of read a little more eclectic. But then we started realizing that, oh my God, we're the bougie book club because every time we meet, we're going to meet at the very upscale steakhouse or the golf club, or, we're going to all these super like $40, $50 plate fucking restaurants are like, oh, okay, they're the Spicy Book Club, but we're the bougie book club.
Gotta own it.
So don't worry, we get it.
Something else he had on there, which I'm going to take some notes today. You're a baker. I heard sourdough. I read sourdough. I've got a starter in my fridge. What flour do you keep it fed with? Just curious. I've recently switched to whole wheat, and it absolutely exploded due to the gluten content, I'm assuming.
Yeah. So I use einkorn whole wheat exclusively. Okay. So yeah.
Okay.
Kind of a weird flour, but that's originally how I got into sourdough was through researching einkorn. In fact, on my channels, buried in there's a whole einkorn sourdough bread instruction tutorial lecture kind of thing.
Really?
Yeah, there's more on wheat genetics than you ever care to know. It's an absurd.
Our buddy Eric would love that. Love that. He does this little deep dive every time we talk sourdough, and I'm like, listen, I just need to know that the structure of the bread is going to be good. And so
Right.
I've actually not had the balls to try to bake anything super crazy yet. And I think it's more of one, I don't want to mess up. Two, it's a time thing. I have done flatbread. I've done waffles and pancakes, and I do my own pizza dough. So I have an uni pizza oven. Love to make sourdough. Love
Same.
sourdough pizza
Yeah.
dough. So, but I'm
Sourdough
pretty particular. It's the best.
For sure.
It's the best.
For sure. It's amazing.
Yep. And then, obviously, I think for any food snob, seasoning, right? You've got to have the right seasoning. I'm a total salt snob. I think I have 5 or 6
I was
salts.
just going to say,
Yeah.
4 or 5 different peppers.
You and Eric both, I will say this don't get him and his buddy started on a fucking salt conversation. I'm
right
sitting there like,
it.
yeah, bro,
I'm there for
it's salt. And they're like, oh no, I have this salt for this and this salt for this and this Himalayan salt for this.
Yeah.
And then, but if you use this salt, I'm like, it's salt, right?
No. Don't ever hand me Morton's.
No.
That is good for my sidewalks. That is for my sidewalks. So up where we're at, where it snows, and you got to kill some ice. That is what Morton's is good for. What is it? Iodide. There's something it's iodized salt, and it tastes so much like a chemical to me that I won't even put it in my body if I'm aware. If somebody sneaks it into food and I don't know, that's the only way I'm touching that stuff. So, yeah. All right. What are some of this?
Unusual.
You can taste it too.
I can taste it. Yeah, it doesn't bother me, to be fair. But it is a different flavor, but I actually kind of like it. So
okay, all right. Yeah. What are some of the things that you are again a little bougie about?
I mean, the biggest one's coffee. Like I'm insane. It's absolute like batshit crazy. My coffee grinder. I'm almost embarrassed to say I spent $700 on the grinder.
On a grinder,
dude.
And so, it's beans have to be roasted less than 14 days ago. Ideally, single origin. Ideally, natural process. And then it's 2 for 1 gram for espresso. Or I use siphon, which is even more looks like a chemistry experiment. It's like a Bunsen burner under a glassware, and it's absolutely insane.
Dude. So
that's awesome.
I have a grind. I do whole bean. Just we'll leave it at that. I do whole bean, and I believe I read somewhere that it is starting to go stale to the point where you can actually tell the difference in taste if it's been ground for more than a half hour.
Yep.
Okay. So it's like I grind it, use it. I have a decent grinder, $700. That's next level. I like it. What does $700 grinder do that mine does not?
Well, I don't know which one you have, but
I don't even know the name of it. I will say I got the different course for for a French press. I use French press a lot.
Sure. So I got the DF64. Basically, like a couple of the features I like. It is set up for single dose, so you weigh out 17 grams of coffee, you put that in the machine, and 17 grams comes out, and so you never have to grind more than you're using, so it kind of helps you save coffee.
Okay.
So that's one of the big things. And then a lot of it's just the technology of the burrs themselves, where, you're getting a very regular, the size of the coffee particle after it's ground, you want it to be as consistent as possible so that they all extract the same amount over time, so that at 3 minutes, each individual particle has extracted a certain amount of flavor into the water. Otherwise, if one's bigger, then it's going to be less extracted than the smaller one that's like completely over extracted. And so that's the goal of a higher end grinder for the most part.
Even grindings.
Grindings, yeah.
Well, that's why they do the coffee different. That's why some drip. There's like a different way the water comes through because it needs to get more contact, I guess. I'm not sure the exact term, but more in contact with the ground. Yep. So for all you Sanka drinkers out there, you are missing some good shit. Start grinding your own beans, at least at a minimum. Buy whole bean, get a grinder, and enjoy your coffee a little more. Yeah, dude, I won't go to Starbucks. I think they serve swill. And everyone's like, there's coffee so good. I'm like, well, you obviously don't know what coffee tastes like because it is awful.
I mean, even McDonald's has better coffee than Starbucks.
Oh, 100%.
Like, if you're comparing, yeah.
Absolutely.
I mean,
gas stations,
yeah.
McDonald's, Dunkin' Donuts by a
Dunkin's,
mile.
yeah. Of the commercials, Dunkin's not bad, actually.
I handed one back to a lady once. I said, give me something that isn't burnt. She was like, we just made that. I said, you don't know how to make it. Give me, and I'm not that guy. I was like, this is burnt and it is
I will
bitter.
say the other side of it though is I've consumed so much like dank sitting hospital coffee in my life that like I'm also not that like if I'm going to Starbucks, I know what I'm getting. It is what it is. It's better. It's better than that thing that's been sitting on the heater, in the back of the hospital nurses station for 12 hours, which I will also drink. And so, whatever.
Dr. Zane's drinking that one where you pull it out of the vending machine and it's got a poker hand on the bottom.
Push come to shove, I'll do it.
I don't drink coffee.
This show ends today, bud.
Yeah. But no, okay. But I did hear this since we're talking about Starbucks. I thought it was via someone bring up here. So I have heard or read that Starbucks, their process of the way they process their beans, that 100% of the time their beans are over roasted.
That's true.
And then, because of that, I have also heard that the over roasted beans are a carcinogenic.
Does
that have any
true? But
I'll say, does that have any merit to it?
That's complicated. So first of all, they do over roast. Part of the plan of over roasting is to hide defects, so you can buy lower quality coffee for cheaper, and then over roast it, and it kind of all tastes the same. Similar process is I grew up in Louisiana, and that's why they started adding chicory to the coffee, and why that's a very Louisiana thing. It was to disguise flaws.
That's interesting,
right? And you can over roast it and then add chicory, and it kind of all tastes the same. As far as carcinogenicity, it's actually really hard to prove carcinogenicity. Like, even, I think a lot of people don't realize this, is that, like, we never did what would be considered a true test of carcinogenicity for smoking. The only reason we know is because it's so overwhelmingly significant that you could tell even without doing anything particularly sophisticated if you just looked at like raw data for a while. And then we got signals after the fact, is that after we sort of like decided that it was causing cancer and people stopped smoking as much, then we saw the cancer rates go down. So that was when we finally actually proved it, after we'd already decided it, right? But very, very hard, especially for small things. Now, people have said that, burning anything and consuming it is, potentially carcinogenic. But
carcinogenic.
It's very hard to prove. And I have my doubts just evolutionarily that, like, one of the biggest jumps in human brain capacity was when we started eating meat. And so the notion that at that time we were eating meat but not burning it is kind of hard to imagine we didn't evolve in an environment to handle that.
Mm-hmm.
But
yeah,
hard to prove one way or another.
Yeah.
And noticing about the difficulty of proving a carcinogenic, I moved from California, and California had that whole Prop 65 thing where you have to label everything as a potential carcinogenic. And I worked at a shop that sold parts for Toyota trucks, and the fact we had to label literally everything we sold had to have a Prop 65 sticker on it, because during the machining process of metal, you use oil to cool metal down. And since oil touched that metal at some point, it's a potential carcinogenic, and we had to label it.
Wow.
And it's like, oh my God.
You damn California people.
Dude, there's a reason I don't live there anymore. That place is wild.
I was there once recently, and I'll tell you what, it's a beautiful place. It really is. Like, the countryside is some of the best driving I've ever done. Absolutely loved it. The ocean was amazing. But yeah, I swear everything I buy, I see Prop 65 on it for everything. Geographically, California is perfect. I loved it geographically. I lived in the mountains. I lived an hour away from the farmland valley, 3 hours from the beach, 4.5 hours from the desert. And it was amazing. I had everything I wanted right there, except California itself.
I have to imagine with that Prop 65, at some point it just becomes more efficient to just plan putting that sticker on everything that you might ever make, and just be like, something in this is carcinogenic. Here's the sticker, and just like.
We recently had something very similar, at least the way I hear what you're saying. So my daughter is allergic to sesame and a little bit of chickpea, but sesame is the overpower. Like she blew up. Her face within minutes was like, here's Benadryl, and we need to get to the emergency room.
Sure.
And so it turns out that it came back as sesame, which luckily isn't in a ton of things. Sure. But recently she loves candy corn, and we're candy corn people in this house. So we're just about to eat this candy corn.
People.
Oh, stop it with you. We were just about to eat it, and my wife glances at the bag and says, may contain sesame oil. And I'm like, who the hell? Like, at what point of the process does sesame oil become a thing? And so what was said to me is, listen, it is more efficient to just put sesame in things than to stop the production of a facility, clean the machines properly, which can take a very long time and is very not cost effective. So to hell with you. If you are allergic to sesame, we're going to put, there may be sesame in this, and then it's your job to not eat it. So is that what I'm hearing? It's just easier to just label everything as something and just move on?
I was just saying that's what I would do if I had a business. I would assume that, like, yeah, if I had a business in California, I'd just assume that something I was making in there would be, and so I would have every plan of putting the sticker on. Just.
Yeah. Well, that's what we did. Then that's what we're doing.
It was literally every single fucking item. We like, did this touch oil at some point? No idea. Prop 65 sticker. Prop 65. Just put it on everything we sell.
Yeah. Well, there we go. Sesame oil.
Sesame oil. I feel like we're getting a little bit into now what we actually came here to talk about today. And I want to dive into it. So you told us that a lot of what you stand for goes against the grain as it relates to healthcare. I would love it if you'd give us a little bit of a high level kind of overview of what your views are, and what's the norm in medicine right now, how things could be better, stuff like that.
Yeah, so I'm in an odd position where I find myself kind of arguing against everyone, which is, entertaining. It reminds me, brief aside, but there's this great Bill Burr clip where he talks about how,
I love Bill Burr.
Yeah, how he likes to put out a tweet that just will really just piss off everyone. So his example was, it was during the election, and he was like, he's like, Donald Trump is such a dodo, he might actually make me vote for a woman. And then just like step back and like let everybody lose their minds, right?
And we're laughing the whole time going, the beauty of that is so great. Oh my God.
So I feel a little bit like that in medicine in some sense, and I'll tell you how. So on the one hand, with standard medicine, the stats are really pretty awful in the sense of like, the average family practice doctor sees 2,500 to 3,000 patients per year. The average visit is down to 12 minutes. They've done a study that indicates that on average, a patient gets to speak for 23 seconds before the doctor interrupts them. And all of that is kind of driven by the structural choices we've made about insurance-based practice. That's one aspect. The next aspect is, even if you had a lot more time and better structure, we've emphasized things that have minimal benefits or no benefits. So, taking cholesterol medicine for just high cholesterol, for instance, right? If you really squint at the data, you're benefiting one people out of 100, one people out of 200, wow. 300, right?
Wow.
If you can even prove a benefit, which usually you can't, right? So in someone that's at really low risk and just has high cholesterol, the cholesterol medicines, you've never shown a reduction, right? Mammograms don't reduce mortality. Recently the Nordic trial called into question whether colonoscopies reduce mortality. A lot of stuff we spend time, energy, and effort on just doesn't work, right? So But that's also because we've kind of given up on patients in a lot of ways where it's like, hey, what does work? Well, cardiovascular fitness works, right? But medicine doesn't want to deal with that because that might be a conversation we have to actually have with patients about what's going on, right? Strength works, social connections work, right? Like for longevity purposes. And so medicine's great at solving immediate problems. I do hospital work. I work in the ICU. And overall, in all the hospitals I've worked at, medicine does an amazing job of pulling your ass out of the fire. Like, if you're going to die tomorrow, an ICU is a great place to be. Like, we do a really amazing job in that regard. And again, all those time constraints are gone. All the money constraints are gone. It's like, hey, if this ends up being charity care, that's the hospital's problem. Like, I'm doing what's right for the patient, and I have that freedom, right? Outpatient medicine has a long way to go, in my opinion. The standard medical model is pretty rough, pretty broken, emphasizing things that are minimally important. Blood pressure control does reduce mortality meaningfully, right? But it's not a huge reduction. And so we spend so much time, energy, effort on doing it. And it's like, okay, but the payoff there it's real. There's a real payoff, but it's not huge. It's not a tremendous payoff, right? And so I think we've abandoned spaces that have been filled now by health influencers who will talk about fitness and will talk about, whatever, behaviors, diet, exercise, but that's the other side of it, is their quality of data, their standard of scientific proof is incredibly poor. They make wild claims because the wilder the claim you make, the more popular you get, the more likes you get, right? So the joke that's from the 80s, Dave Barry wrote in one of his books that, if you go to a publisher and you say, hey, I want to write a book about Harry Truman that says that he was a flawed but ultimately, decent president who made some tough choices, and history, will say, what he did, they'll laugh you out of their office. If you go to them and say, hey, I want to publish a book that on how Harry Truman was actually secretly a Russian ballerina, then you'll have a market. And
100%.
Yeah, same thing in the health influencer space, right? And I think the big issue is they're not doctors. They haven't been around the block to realize how many times the initial data looks good, and then when you actually try it or you actually do a real trial, it turns out it doesn't work. And we see that with pharmaceuticals like Zygris. Zygris was approved by the FDA. We started using it in ICUs all over the country, and it actually ended up killing patients, and because we did it on the basis of preliminary data, not real trials, right? In real time, we're seeing it right now. Talking about being against everyone, right? Vaccines are a hot topic, and like some people have all kinds of different views. My I think data I've read indicates that if you were unvaccinated and had not had COVID, the first two vaccines, and you were over age 60, right? The first two vaccines were very convincingly life-saving, right? The first two in the series. Boosters, I doubt, have any benefit whatsoever. Vaccination of anyone, certainly under 30, I doubt has any meaningful benefit, right? But somehow we did it wrong in both directions. We got people who think vaccines never worked and didn't do anything. That I don't think is true. We got people who are like, every booster you have to have, and we should be vaccinating everybody over 6 months. And I'm like, that's also not consistent with any meaningful data, right? So I kind of end up arguing with everyone on something.
That's the way politics is too. I'm going to make a statement. This statement is going to piss off 50% of the people, and the other 50 are just they're going to be in my corner. And that's any statement. Doesn't matter what that statement is. Listen, I mean, we don't normally get into politics.
Sure.
Because again, everything has a political argument to it now. But I will say something very honestly. Okay. I consider myself to be intelligent, whether I'm Dr. Intelligent.
That's a stretch.
That's a stretch. We'll see. But I read things. I like to read. I like to do my own research. I don't like to take anyone's word for shit. And quite frankly, I will hear what a doctor says. I respect what a doctor says. And I know probably 99% of what I'm hearing is probably on the right path. And it's not like I don't trust anyone. I am not vaccinated. Okay. Now listen to how many people are going to fucking hear this and give me shit. Okay. I'm not vaccinated, not because of any political belief, not because somebody's trying to kill me or plant a microchip or anything like that. it comes down to, at the time, I believe, and what you just said, I believe there were a great number of people that benefited from the vaccine. I think and notice the word think, I think that vaccines would reduce how bad the illness was when you get it, because I've had COVID and I didn't enjoy myself. It wasn't fun. But I didn't know enough about it, and I'm just a believer in my own body. I've always been healthy. I always like to give my immune system a go when I get a chance. I realized that I may be taking a risk. I realized I may not be. Like, I'm not a doctor. So my reasons for not getting one, it wasn't to be problematic. It wasn't to go against the grain. I just said, well, eventually this thing is going to just blend in with all the other sicknesses you can get over time. And that's just the way it is. So,
and it's funny you say you're not vaccinated, right? But you've had COVID.
But I've had COVID.
So are you not vaccinated?
But now, you tell me.
That's
right?
kind of the point. It's like, well, I mean, yeah, I mean, the evidence. I mean, people, again, politically, right? People resist the notion that those two things are intimately related, and basically this. Yeah, I mean, like, well, we don't know if they're the same or not, but that's a broad statement. They're very closely related. Let's say, right? Like, maybe one has different studies show different things. Some show advantage to one, some show the advantage to the other, maybe in terms of duration of protection, maybe in terms of whatever. But we don't know. Like, we haven't done 20-year studies. How would we have done 20-year studies, right? So,
right.
We don't know. And so you can speculate all you want, but the reality is they're very closely related. And the benefit was always going to be in the elderly, right? The more at risk you are of dying from something, the more benefit you're going to get from something that reduces death. The problem in kids, for instance, is like their risk of death is so low. How are you going to to prove a reduction in the death rate in 5-year-olds? You would need a study with millions of kids participating in both the placebo and the real arm, because showing benefit in reducing 0.00001 to 0.0000001, you need millions of people to do that, right?
Right.
Whereas if the risk of death is 20%, well, going from 20% to 5%, you're going to see that. That's not that's not subtle, right? But also, then how much do you care about that 0.00001 reduction? Like, that's again back to the statin question. Do you if you had to take a medicine every day of your life for the next 20 years to reduce your chance of having a heart attack by 1 in 300, would you do it? Maybe you would, maybe you wouldn't, but it's not an obvious win, right? It's like, that's a lot of commitment for a pretty small payoff, if any.
It's fear, right? It's like everything else. We're very particular with our commercials and the way we see medicines work on TV and the way we see medicines pumped into our face, via advertising, to the point it's like, hey, if you don't do this, you're a goner. I think the one that frustrates me now a lot has been, and I know nothing about the medicine, but I know I believe it's for diabetes that reduces weight. It's the big one going around that now there's a shortage.
Yeah, Wegovy or tirzepatide or semaglutide. Yeah.
Yeah. So, from what I understand, right, this medicine is created to benefit people that have diabetes. And oh, by the way, I'm fucking dropping weight big time. My problem with medicine is, like, that's an after effect. That's a side effect. That's one of the things you hear when you hear, oh, side effects may include weight loss, rapid weight loss, something like that. But when they started prescribing it for weight loss, and again, not knowing medicine, is that wrong of them to do? That seems wrong.
No, not at all. Actually, I mean, we prescribe all kinds of stuff off label for a variety of reasons, both political and scientific, right? So one common thing is, like, there's medications that we know have certain effects over 40 years, like we've pretty well established, but it's an old medication. It's not going to make anybody very much money. So nobody bothered to get FDA approval for it. And we just use it off label because the studies support it. There's good scientific evidence. And then, in general, just even scientifically, the dose makes the poison, right? And so you take enough water in, it's poisonous.
Oh, yeah.
And so, what's the difference between a side effect and a real effect? They're all effects. It's just chemical effect. And so It's about manipulating things to get the benefit you want and then the risk of doing so, right? So to me, in terms of, rather than classifying things in terms of effects and side effects, I tend to classify things in terms of risks and benefits. And so weight loss was a benefit, and there are risks associated with it in a variety of ways. I did a whole podcast with a buddy of mine who's also a doctor, and we both tried Ozempic ourselves and kind of had different. We came to different places on it, and so it was interesting because we're not the right audience. We're not obese. We're not whatever. So, does it even apply to us? The studies are questionable. They were only done in obese people, right? None of these people were instructed to lift weights or to change anything about their lives, which is how you should do a study, by the way. They did the right thing because they're just trying to isolate the effect of the drug. But it leaves us with questions because, people lost a ton of weight, but half of it was muscle loss, which is common any calorie restriction. If you get somebody to just restrict their calories, half of what they lose is going to be muscle, right? Now, if you also tell them to lift weights and you also tell them to eat protein within that calorie restriction, then they won't lose that muscle, the same amount of muscle or maybe any, depending on how much the restriction is. And that study just hasn't been done. It's too early. And so, again, I've got no problem with operating with the information we have, but we have to change it as new information comes in, right? And that was a great example, actually, of that going back to COVID, right? I think the latest information on masking is that it didn't work, probably didn't do anything, right? In March of 2020, we should have been masking, certainly in the hospitals, right?
Right.
Because we didn't know, and the only information we had is that in South Korea, in the hospitals, they implemented absolutely rigorous, draconian policies. Every healthcare employee had to mask. They removed half the chairs in the cafeteria so people wouldn't face each other while eating. They told people not to talk during lunch. Like, it was absolutely rigorous. And they had a 0% hospital transmission rate to healthcare personnel. That's the only bit of data we knew.
That's interesting.
That level of draconian implementation worked. And so we should have been trying to mimic that. Now, the fact that afterward we found out that it wasn't the masking doing any of that work, right? It was the other policies they had in place. That's fine.
The not talking and not sitting near people, like just the way.
Correct.
If you could see, if I exhale and you could see a big red cloud, you'd go, oh, look where that goes. That's interesting. You don't want to breathe that into somebody's face, or if you sit sideways, you're not going to come in contact with that.
Totally. But the information we had based on studies that had been done on influenza before and so on and so forth indicated there was a reasonable chance that masking would work. And we had to operate with the flawed information we had. The problem is now we know better. Now we should not be masking in public because we realized that it didn't work. And by the way, most people either had it or gotten vaccinated, one or the other. And so the risk factor, the landscape has changed. And so you can't hold the same belief when the landscape of both information and context has changed. And the same is true in so many different areas where, as new information on Ozempic, same medication, but as new information comes in, we may find out that, hey, this is not good for X, Y, and Z reason. And we'll have to update our beliefs. Right now, kind of the conclusion my buddy and I came to is that the risk of remaining overweight probably outweighs any of those future potential risks, just because it's such a dramatic mortality factor. And so, net benefit probably for people who are genuinely obese or overweight. For people who are not very obese, myself, I just want to lose an extra 10 pounds so I can get a six-pack, probably the risk benefit's not there, right?
Okay. That's interesting. That's a good example. So. Yeah, I noticed Fauci got a lot of shit, right? And it was, again, doctors in general, you guys got a lot of shit. And it was like, they're dealing with the same data that the public has. We're all trying to figure something out. You can't, and I believe that the majority of people, they wanted what was best for people. Hey, wear a mask. Okay. And now you go back and you say that, okay, maybe masking didn't do what we thought it would do. Don't throw that in somebody's face. Don't be mean to somebody because they're still wearing a mask. Like, you can find those videos anywhere. Somebody's going to yell at somebody, I'm not wearing a mask. Dude, you just want to be an asshole.
By the way, on that note, that was the other reason I was very in favor of masking early in the pandemic. Honestly, I saw it, frankly, as I didn't care as much about the politeness or as much about the science as the politeness aspect.
Yeah.
Is in the middle of a pandemic, people are suffering, people are dying. It's a gesture that says, I hope your grandmother doesn't die. That's all a mask is. Whether it works or not is irrelevant. It's a social gesture of well-wishing. I hope your grandmother doesn't die. That's literally
minor inconvenience. Unless you have eyeglasses, then it fucking sucks because I'm sitting there fogging up all day long, and I'm trying to figure a way to rest it on the mask, and so. But yeah, just again, I think anymore we just want to argue with anyone that will hear or have an argument with us. Let's go.
Sure.
And at that point, like you were saying, it was a risk versus benefit thing. What is the risk you're taking by wearing a mask? It's not harming in any way. It's a minor inconvenience, but it's not going to harm in any way. And the potential benefit at that point, we didn't know, but it was a potential benefit.
Totally. I'll give you myself as a very extreme example in some of it. So I had a very different experience with the pandemic because I was flying all over the country to work in ICUs and hospitals for people who were dying of COVID. And so, I would go in, I have a beard, and initially in the pandemic, I shaved my beard to get an N95 to stick for the first time in a decade. And then
this guy has a great beard, by the way.
That's
a fantastic beard.
Appreciate that.
Sorry, love it. Sorry, you needed to hear that.
I appreciate it. Yeah. After I shaved it off, I remember why I keep a beard on. I was like, oh God, that's not good. So I, but the N95s have never been particularly sticky for me. They've not been great. And so I had worked with a buddy of mine. We 3D printed a purified air respirator with a motor to pump air through a viral filter. And it was entertaining on a number of different reasons. Number one, it's 3D printed. It's basically a plastic bag over my head tied around the neck with purified air being pumped in one side and pumped, and pushed out the other. But on the other hand, I trusted it more than I trusted the N95s, based on scientific principles. Number two, if I'm in airports or walking around, I was just in an ICU yesterday. I don't know if I'm infected or not. I don't know if something failed or not. And so I'm not trying to infect anybody else. I'm doing something that's very unusual, moving literally from a high risk environment directly into a high traffic environment. And so, I wore that absurd plastic pumping respirator in airports through the whole flight all the way, and then back to my house.
And it went straight up all over your head.
Yeah, it was a plastic bag on my head, tied around the neck, with a little device to pump purified air into the bag. It was the most insane thing. Yeah.
Oh my God, that's incredible. People thought you were fucking insane.
I literally had to wear my scrubs to fly because I'm not sure they would let me fly looking as crazy as I did.
Wow.
Unless it's one of the few times I've leaned back on my doctor authority there to be like, no, I'm actually a physician. You should allow this nonsense to happen.
Give me a stethoscope to wear with this fucking bag over my head.
Exactly right. Exactly right.
Good.
There were benefits to it. Patients were able to see my face, right? Because it was clear plastic. So even in the middle of whatever, I think that was a hard time in the pandemic is patients are dying, really struggling, having a rough time. And, can't even see their healthcare provider's face or family's face or whatever. And so, that meaningful sort of personal touch, I think, was really beneficial in a variety of ways. But it was an absurd device at the same time.
I agree. So, I had a new dentist during the pandemic. And to be honest with you, the girl that cleaned my teeth, no clue what she looked like. And then saw her after the fact in the lobby. I was like, oh shit, I know you. You needed that mask to know what people looked like. And I was like, that's a really weird thing, especially for kids.
Very odd.
Kids struggled with that. You took them out of school. They need that social interaction, which you mentioned earlier. Being around people is really good for your health. It's really, really good for your health. And just that environment was taken away from kids. And again, maybe rightfully so, right? We don't know what we're dealing with. And again, I think at the end of the day, we just want to live. We just want to be not sick and so on.
Yeah, and I think to me that the whole process of the pandemic was an interesting indictment of the scientific process on all sides, right? So like on the one side, you had people who, believed in like hydroxychloroquine and that kind of stuff, and it's like, look, this is exactly why health influencers get it wrong. This type of science does not translate into clinical efficacy. We know this. We've done it. Whatever, right? The flip side is then the standard medical institution is lying to people, saying that, at first you don't have to mask, then you do, then, this works, boosters work. Like there's all these other, and you've lost the trust because you've burned too many bridges. You've told too many lies and been caught out at it. Oh yeah, it doesn't cause myocarditis. Oh shoot, it does. Okay. Well, how many times are you going to lose the public trust by saying something untrue and getting caught and then wonder why people aren't listening to you? It's, yes, the truth is nuanced, but speak in a way that's consistent with the evidence we have at the time. So yeah.
Okay. So on that note, I mean, that's a good point. So like, right, moving on from COVID, but we do find ourselves in a weird spot. Okay. Because like you said, we need to trust doctors, the education, the amount of information that you know versus what I know versus what Trevor knows. And then you've got the insurance piece, which I think we can all go, okay, this is kind of shit. And then it really was the perfect storm of what the hell are you supposed to believe? I want to believe a doctor. Exactly right. I certainly don't know more than a doctor, but I do know that insurance screws people. It helps other people. So it's you don't have the information to make a choice for yourself.
The problem's even worse than that. If I can further be pessimistic there. The problem is that how do I put this the doctor doesn't even know as much as the doctor. And and what I mean by that is I put out a video on, kind of how the influencers kind of talk about blood work in a particular way or whatever. And I was kind of criticizing them. And in the original version of the script, I was like, that's because they're not doctors and this and that. And I talked it over with a buddy of mine who is a physician. And he was like, yeah, I didn't know most of this stuff, and he was like, this is not a doctor. This is just a you problem. Right. And I thought about that for a while and I realized that he had been taught to interpret blood work the correct way, quote unquote, but didn't necessarily know why. Because somewhere in the medical education, someone knew why and said, this is how we need to teach doctors. But he himself
left out the context.
Yeah, exactly right. So there's a cultural wisdom in the institution of training physicians that creates the correct interpretation for blood work without maybe the individual doctor knowing why. The problem then is what happens when the institution gets it wrong, right? Because unless the individual physician is well educated, this is why we interpret blood work this way, and this is why this new blood test, the rules don't apply, and we got to do it differently, or, actually, this is a bit of a different situation, then the doctor's just kind of following the status quo and not necessarily doing the best thing, right? And there's tons of influence. The pharmaceutical influence, companies influence how the guidelines are written. The American, mammograms, I mentioned earlier, mammograms have not been shown to reduce mortality, but the American Radiological Association certainly wants more mammograms done. So we're going to move it down from 50 to 40, move it down from 40 to 30 if we can, so on and so forth, right? So there's so many different influences at the institutional level that there's rightful mistrust that the institution is teaching doctors the individual correct data, right? And so, yeah, the problem is that getting a medical education sufficient to even know, really, you'd be talking about knowing more than your average doctor, not as much, but more than your average, not only what they know, but why they were taught to do things that way. That's a tough ask. I mean, that's a really tough ask, but it leaves people in a tough spot. Like, hey, how do I trust my physician if I know that the things he's reciting are based on an institutional guideline that was itself influenced by industry?
Yeah. I mean, follow the dollar, right? This is a good example of follow the dollar. These pharmaceutical companies want, yeah, I mean, everybody wants their products used. They want their pills taken. They want their shots given, which is business, which is fair. But
and I get it.
We need better, you know.
I get it, but so just I was joking with a buddy of mine. You know, in my practice, one of the things I'm really proud of is how many people genuinely just get better. The problem is then they don't renew their membership because they're better, right? And so from a business standpoint, it's like there ain't no money in a cure. That immediately
was that Chris Rock?
Yeah,
there's no money in the cure.
Rock. Yeah, exactly right. Now that's exactly what I'm discovering. Right, is that like I get patients better and then they leave, and so I've got to have a better marketing engine to figure out how to get new patients because where's the pharmaceutical company? Yeah, hey, if they can get you on Ozempic, right, and that's how you get your diabetes under control and your weight under control. Well, that's great. You will live longer. They document that's a great drug. It's going to be life changing for a lot of people. I'm a big fan. I love it, right? But it's also great business. I mean, like you got to take this thing basically for the rest of your life, and
we can use this drug for this many groups of people.
Sure.
It's a win. It's a win, right?
Yep.
So,
yep.
Oh my goodness. Oh, wow. Yeah,
so
that's,
I will
scary.
Say,
it's scary.
I will say, I think part of what I'd like to do is to get further into the public consciousness a bit more scientific literacy, right? And I think that actually can help fix a lot of the problems. And we're set up for this, 40 years ago, nobody knew how to operate a phone. Nobody knew what, Wi-Fi was or whatever. We will adapt to adding things. So I think you can get really far with a couple of basic concepts, right? So number one, if it's not a study done in humans, it's irrelevant. If you're not a mouse, you're not a rabbit, you don't need, it's going to be irrelevant, truly, deeply irrelevant, right? That's a tough pill for people to swallow, but it's actually very true, right?
So we tested this on rats. It's cool for you. Doesn't
apply. It doesn't apply, right? And that would be the first one I would do is ignore animal studies. Number two, you can pretty safely on the public level ignore epidemiological studies. So if it's not a randomized placebo-controlled trial, you can pretty safely ignore it. So all these studies that say...
give an example. Give an example of that.
So most of what you see like kind of hyped, like, oh, chocolate increases your risk of cancer, or coffee reduces your risk of heart attacks, or whatever. All of that is not done by a placebo-controlled randomized method. And so that I'll just go into is most of how that's done is they say, oh, let's look at all the people who drink coffee and all the people who don't drink coffee and see how many heart attacks they have, right? The problem is that there's a lot of things that go along with drinking coffee. People who drink coffee...
Like cigarettes.
Exactly right. Exactly right. And actually, they thought coffee caused lung cancer for a little while because people at the time were smoking and drinking coffee at the same time, right? And that's the kind of epidemiological error that can happen. So actually, this, not to go back to COVID, but the booster issue is the same, is that like they showed the boosters reduced the risk of death by 94% from COVID, right? But it also somehow magically reduced the risk of death by car accident. Well, no, you're just talking about people who are more cautious by nature, right? The more cautious people are more likely to drive safely and more likely to get the booster. And there's no relevance to the actual medicine. We see that all the time. There's a third factor that's causal, right? So anytime you see the words associated, relationship, risk, right? Those are not causal studies. They're not placebo-controlled randomized trials, and you can pretty safely ignore their results.
Okay. Good to know.
So if you see, on the other hand, hey, this was a placebo-controlled trial, randomized in humans, then at least it's worth reading the study, right? You've already cut down your necessary health reading by like 95%.
Right.
Furthermore, if more people in the public started doing that, it would disincentivize publishing these nonsense studies because they wouldn't get read. So we would greater public awareness of which studies are actually scientifically valuable would actually start to slant the scientific world in a really positive way and say, hey, we don't fund 100 nonsense epidemiological studies. Fund one good placebo-controlled randomized trial.
Yeah. And that's, that falls on us too, right? We need to be better. The general public needs to be better. We need to do our own homework, and homework is not fucking Wikipedia. Homework is not, there's this guy on Instagram that told me if I drink this, then this happens and that's better and I'll never get that illness. And so it's just, I just think we don't give ourselves enough credit for being able to do our own research and just figure things out. Like, smile, love people, be kind, be in groups of people, be around people. Don't abuse your body. And you'd probably right there, just with that, see people start to live longer and be happier. And
I think people need to realize the power of placebo, right? If placebo were not a significant effect, we wouldn't have to account for it. We wouldn't have to do placebo. But because our minds are incredibly powerful, you have to do a study, right? And like, so I think we talked about before the notion of like placebo surgeries, right? Like,
yes.
Right.
I was going to bring that up. Yeah. That's like, a crazy thought, but
for years and years, we did
done.
surgeries to repair a torn meniscus, right? Until somebody said, and it seemed to work, right? It reduced pain, so on and so forth, improved mobility. Finally, somebody said, okay, what if we go in, we do the surgery, open the knee, and half of people we actually repair the meniscus, and the other half we just leave it alone and come back out without doing anything. And both groups got better equivalently, right? And all of a sudden, you realize, actually, the entire benefit of the surgery was the placebo effect. Same things happen with heart stents, right? So people with 70+% blockage who have chest pain, difficulty walking, reduced exercise capacity, they took half of them, they went in, they did a whole cath. Half of them, they actually put a stent in. The other half, they just dicked around for 15 minutes and didn't put a stent in, right? Came back out. Both groups improved their exercise capacity. Both groups had reduction symptoms equivalently, right? And so you start to realize,
that's a wild
powerful
swing and a risk to take, though. Like,
it's absurd.
Hey, this guy has a potential heart problem. We're not going to put a stent in to see what happens, and we're going to make.
They're
him
aware,
think,
correct?
We're
They're aware that they may.
What's that?
They're aware. I just want to make sure, they're aware.
Oh, yeah,
If so,
the patient
I had a
consented
meniscus
to the
surgery.
study. Yeah.
Okay, good. So going into it, you may get a stent, you may
Correct.
not.
You've got a 50-50 shot.
Okay.
Yeah, you're told you've got a 50-50 shot of getting a stent.
Wow. The brain is a crazy thing, is it not?
It's incredibly powerful.
I had a meniscus repair.
Sure.
But I know that it was repaired. But that's an interesting thought that if they open up the knee, and again, it was scoped, so I think that's very minimal. Two little, points where they go in. Your brain is crazy.
It's crazy. Like you're talking about this, not even just in the placebo effect, but just the way what your brain can do.
Yep.
I remember when I was about 10 years old, right? My mom had breast cancer. And she caught it pretty late. It was a whole thing. And then she was going to all of these, she had all this radiation and chemo and stuff like that she was going through. I just remember her telling me, I'm going to beat this because it's a mind over matter situation for me. She said, it was like, I'm going to beat it so that I can be here for you kids for a lot longer. And she goes, and as I'm sitting in these chemo treatments and I'm sitting there watching these people, she said, the people that make it out, the people that beat the cancer, whatever, and get on with their lives, I've noticed are the ones that are happy. They're talking during the treatment. They're dealing with it. And shows the people that I see that come into these treatments that have their head hung down low, that look like they have given up. Suddenly they're not at treatment scene because they didn't work for them. They're dead. And that idea of mind over matter was instilled to me at such a young age because of that. They're like, you will be amazed at what your mind can do for your body or how your body follows your mind. If your mind has given up, your body is going to give up. If you are fighting in your mind and you want this to be beat, then your body can do amazing things if you put your mind to it.
So that's a great I have so much to say, actually, if you don't mind me picking on that story.
Go.
Please, that's why you're here, buddy.
There's like 4 layers to that story. One is to illustrate exactly how modern health influencers go astray in some sense, because it's not out of evilness. It's our minds are pattern finding engines, right? And so your mom saw this pattern that, hey, people that come in are kind of down, not really talking. They tend to not make it, right? People who do tend to make it seem to be more upbeat, X, Y, and Z, right? So the problem is maybe the people who are down is because they were sicker before they got cancer, right? So it may not be that it's the attitude that makes the difference. It may just be that the attitude was caused by a pre-existing health issue that is unseen from her eye. She would have no way to have insight into that.
Absolutely.
Right? So again, that's the notion of confounding. And there's plenty of people who are upbeat and happy and like totally get through it and also die, right? And so like that's another aspect of confounding. The flip side of that, though, is there does seem to be a real nocebo effect, which is the opposite of placebo, right? Is that, if you believe something will harm you, it will tend to harm you more, right? You'll perceive that harm more strongly. And so, yes, there is some consequence to having negative mental state, right? Now, is that purely subjective? Does it increase truly your risk of death? I don't know that I've seen studies on that, but that's why we need studies. You need something to hang your hat on. There's a great example. I forget the name of this. There was a guy who was convinced his horse could do math, and he was a mathematician, right? And he took this horse all over. I think he was Russian, so I think he took his horse all over Russia, and would do these shows where people would like call out math problems, and then like the horse would stamp its hoof a certain number of times, and it was right. Like a lot of the time, like with really fairly complex things. What people didn't realize is that the horse had actually just learned to read the guy incredibly well. And the guy was he wasn't even sure how, he wasn't intending to do it, but somehow he was communicating the answer to the horse. And the horse was just trained, when he stands like that, I stamp my hoof 4 times. When he stands like this, it's 3 times, right? And they didn't find that out until they blinded the study and they put a curtain between the man and the horse, and then the horse couldn't do math anymore. And so so this is the notion of a double-blind trial, is that even if the researcher knows which pill is placebo and which pill is real, that can confer a difference in the effects on the patient. So both the researcher and the patient have to have no idea which one is which, because our minds are so powerful at finding these patterns, right? It's just such an incredibly powerful pattern finding engine. You really have to be careful about how you load it, right? Going along with it, so a lot of my patients have the view, I call it the placebo immunity illusion, the idea that I'd be able to tell, right? Somehow I would be able to know whether I was being placebo or whether it was a real effect. And we're all tempted by that notion, right? And that's because we view placebo wrong. We view it as being fooled, right? When in fact, it's just the exact thing that makes you human, that makes you, in fact, in some ways, probably the smarter you are, the more likely you are to placebo yourself, because your brain's better at finding patterns. Your brain's better at directing things, right? So yeah, I mean, intelligence is a known a known factor for making you more susceptible to hypnosis. So is reading. So is reading fiction, right? So is a sense of adventure. Like all these things make you more likely to be hypnotizable, and hypnosis is basically the art form of placebo in some sense.
Wow.
Damn it. Mike,
that's crazy.
We got to get a hypnotist on the show now. I'm apparently very susceptible compared to what he just said.
There you go.
I watched one. This girl ate a fucking lemon. A lemon. She bit into this thing. They told her it was an orange.
Yeah.
She bit into this and didn't wince. I mean, she ate it like it was an orange. And I was like, that is crazy.
What?
She was out of her mind because she was real conservative, just quiet, sweet girl. It never, however many years you knew her, never did a thing. And this girl was up on the stage hooting and hollering like a crazy person, bit into a lemon. And I was like, that is the craziest thing I've ever seen. I was sold at that point that hypnosis is real. I was a little bit younger at the time where it was one of those, is this a trick?
Sure.
And as I got older, I said, no, that's not a trick. Like that is your brain.
It's a
thinking.
It's interesting. Stage hypnotism is interesting because it's a little of both, right? So as stage hypnotist, we'll say, hey, let's get volunteers, right? Anybody who volunteers is already a bit of an extrovert, at least subconsciously, right?
Okay. Yeah,
so they watch who was pushed up by friends and who actually was willing to go. So that's some part of it. Then they do an initial induction. They try to get people hypnotized. There are signs that you can watch.
They kick people off.
And they kick people off, right? So the people they're left with are people that are subconsciously extroverted and susceptible to hypnosis. And so it's a bit of a trick in that regard, but then the hypnosis is real from that point forward, right?
Okay.
Yeah. And
that's crazy.
By the way, while we're on hypnosis is actually much less like I'm trained in medical hypnosis, and like so part of the class is you hypnotize each other. It's much less interesting than you would think. Like if you've ever read a really good book and like just been completely lost in it, that's hypnosis. It's not that you can't come out. It's not that you can't. It's you don't want to come out. Like what I'm here for a reason.
Yeah.
Right. If some reason popped up that you had to come out, well, you'd drop the book and you'd kind of go do whatever it needed to do. But like, you don't want to. You want to stay absorbed in the book because it's fun, because it's interesting, because that's what you're doing right that minute, right? And so there's this weird sort of like compulsion that's actually not that strong, but like nonetheless you're compelled to keep reading the book or keep, whatever. So it's pretty relaxed in that regard.
It's like our phones as well, right?
Yeah,
you
for
look
sure.
at it, you grab your phone and you're like, okay, it's 3 a.m. It is time for bed.
Yeah. Yep.
So, okay. Yeah, that's it. I guess so. Then that's a very general term, right? Hypnosis.
Yeah, there are a lot of people who argue that everything is hypnosis. If I say, hey, can you imagine a blue elephant? Well, that's kind of hypnosis because I put an idea in your head, right? So
yeah,
you can go pretty broad with it.
You did mention something else. You mentioned longevity,
subjective
longevity.
Yeah.
That's kind of your thing, is from what I've gathered in reading about you and looking at your website. Tell us a little bit about that. I mean, because to me, it's right. Is this a shower thought, right? Is this something that just pops into your head and it's like, you know what? I've been thinking about this a good bit. Or these are things that keep you awake at night.
Yeah.
Right? Can you explain to the listeners kind of what that is?
Totally. This is the core of my practice, my YouTube channel, all of it, right? And it's been a long road. It's been a long evolution. So it's worth maybe even kind of quickly going through that. Like I was a philosophy major in undergrad. Knew I was going into medicine, but kind of did that on the side. And part of what appealed to me was there's an element of osteopathic philosophy that says that, the role of the physician is to find health. Anyone can find disease. And so that got me thinking like, okay, cool. What is health? And then you run into these super generic definitions, like a subjective feeling of wellness. And I'm like, okay, that tells me exactly nothing, right?
Absolutely
and so,
nothing.
Yeah. And so like I started thinking like, okay, what is health really? And I realized it's kind of like money in the bank. It's the capacity to do the things you want to do, right? The problem with that is then you need an idea of what you want to do in order to decide how healthy you are. There's the link between your intention and your health status is fundamental, right? Well, what do you want to do? And typically people, the thing that came to it is this notion of meaningfulness. Like people who decide to be parents, like if you talk to them, like it's a laundry list of how awful it is. Like I haven't slept and they're driving me crazy and I have no time for myself and I'm constantly being touched and like everything's broken and everything's
everything's expensive.
Exactly right.
Mm-hmm.
And then at the very tail end, it's like, but it's worth it, right? And that's meaning. Right, is that it's not pleasure, it's not contentment, it's not happiness, it's the sense of things being worth it, right? And that is what we experience subjectively as depth or fulfillment in life, right? So yes, I do care about longevity in the objective sense, the duration of life, but there's a limit to how much you can optimize that. There's like 5 things, right? You increase your cardiovascular fitness, increase your VO2 max, which is the measure of that. Increase your strength overall, right? increase your level of social connectedness, don't smoke, and manage your blood pressure. And you're basically at 95 to 99% of your capacity for longevity, duration, right?
And the things you can control. You can control those things.
That's right. And so after that, you can sort of let go of the notion of longevity in some sense and focus on subjective longevity, which is the depth and meaningfulness of your experience, the quality of your experience, which is, am I spending my time pursuing the things that really are meaningful and fulfilling to me? And there's a lot of ways to know that. So one of the great examples I love is Rory Sutherland. He's a marketer. And he points out that the British government at one point spent something like $6 billion building a new high-speed train between London, or not between London, between England and France, like through the Channel, under the water and all that stuff, right?
Under the English Channel, yeah.
Correct. The high-speed train trip was 40 minutes faster, so it went from like 3 hours and 10 minutes to 2.5 hours, right? And he said for $6 billion, what you can do is you can save 5 of those billion, take 1 billion, hire the world's supermodels to walk up and down the train serving champagne, and people will be asking you to slow the train down, right? And so...
Here, facts.
Yeah.
Funny and true.
Absolutely. And so that notion that like it's not the objective time that matters. You're spending a lot of money optimizing the objective time when what matters is the quality of the experience. And so in a more serious way, he pointed out they didn't have Wi-Fi on the train. You could have spent $1 million instead of $6 billion and put Wi-Fi on the train, and nobody would have cared that it was 40 minutes longer, right?
Yeah.
40 minutes without Wi-Fi, I can't work, I can't do anything, well, then yeah, that's a long time. And so that's part of it too, is that when you're doing things that are meaningful, that put you into a flow state on a topic that you care about, you will perceive your life subjectively as much, much longer. And we actually have some psychological data on this, actually, is that people's perception retrospectively of having, like, how long was last year? Your subjective sense of that is correlated pretty directly to how many important, novel, and meaningful experiences you had during that time.
So when you have, wow, man, that vacation really flew by, and it's like, well, maybe you didn't do enough stuff.
Yeah.
Right? It's kind of like that.
Oddly enough, the odd thing is that the same things that make it feel like time flew by when you're doing them are the things that make it feel like that year was really impactful in retrospect. Right? So it's a really weird thing where like the same things that put us into a flow state and be like, oh, wow, yeah, I was taking care of my kids. I was wholly occupied with that for years at a time, right? But then 5 or 10 years on, you look back and you're like, man, that was incredibly meaningful. How kids grow up so fast. And so, when you look back, that notion of time having gone by quickly, but also really deeply meaningfully, those things are linked in a weird way.
So you get right to just throw a couple examples out, right? You've got 100-year-old, they live to be 100, and they're an asshole. They're an asshole. 100 years of being an asshole. And then you've got, and they die. And then you've got a 40-year-old that dies. But during that 40 years, they've touched more people, they've met more people, they've had more of an impact. And then there's this person lived a long and wonderful life, and then this person was taken from us too young. Well, maybe that person actually lived longer.
Yeah.
Maybe is that kind of where, like,
exactly right.
Yeah. What's 100 years if you don't make anything of it?
Actually,
and if you're 40, that's just that you're saying that. And that's what I'm hearing is, what is time? What is length?
Absolutely. And what's interesting on some level is you can even have a mental model of this pretty quickly, right? Duration of life is the width, like the length, right? And then if you imagine a rectangle, that's the height of the rectangle is the depth and meaningfulness of your experience at that time, right? And what you're trying to do is not optimize just the length. You're trying to optimize the area of that rectangle. It's the combination of how much time did you have and how deeply did you spend it. And it's like, yeah, you know what? Like maybe being an artist increases the meaning of my life so much that I'm willing to trade off a couple of years at the end for whatever reason, right? Or I want to win an Olympic gold medalist. Like those guys tear up their bodies. It is not a longevity factor.
Oh yeah,
right?
No, not
at all. But it's a meaningfulness factor, It's like, cool, I'll live 10 years longer or shorter, sorry. And if I get to be a world-class Olympic gold medalist, yes, it's worth it to sacrifice 10 years of life at the end, right?
Yeah.
And parenting's like that. Discovery is like that. Scientists feel that way, I think, a lot, who are engaged in really meaningful work. People who, build community, as you mentioned, like people who touch a lot of lives, they feel that way. John Vervaeke has a great insight. He says, you can start to figure out this is what do you want to exist even if you don't? And that kind of touches on that notion, right? Well, how do you want to be remembered, right? Those kinds of questions start to hint at what you find meaningful.
Okay. So with all that being said, so River Rock Medical is your practice, okay? Bring this all together, right? Tell us about your practice. I'm very interested. I love your YouTube channel. And by the way, everyone check this guy's YouTube channel out.
Thanks.
I know everyone listening to this is loving this episode. And your videos are amazing.
Thanks,
Not
man.
only, and I said this guy's voice and beard are fantastic, super friendly.
Yeah.
And he just, there's a passion when you do what you do.
Yeah.
And I feel like if I was one of your patients, that I go, this guy's amazing. Love seeing Dr. Zain, right? Just good guy. And I feel like you want what's best for me. I feel that. I know that is true, right? Because you know there's something broken and you can do your small part to fix it. You can't change everything,
Sure,
but you can control what you can control. We tell our kids that in this house. Be kind to people. Don't judge people. Be friendly. Be the person you want to see in the world, right? Just do you, and there are things that you cannot control. We can't worry about those, but we can control what we can control. And so, like, your channel, your practice, how do all these things work together? What's it like to be a patient there? Kind of walk us through that. And kind of on something else, which is interesting, concierge, right?
Sure.
Right? I think that's an interesting.
Yeah, so I got stuck with the term concierge.
Tie that all together, please.
Sure, yeah. I got stuck with the term concierge because that's the prevailing term of art for a practice that doesn't take insurance and charges a yearly fee for membership to the practice for sort of all the things that are included in that membership. So that I got stuck with that term, but it implies a level of convenience, which is how it started, right? It started with doctors that were easy to access and so on and so forth. For me, I always joke, there's two versions of luxury, right? There's the Bentley version of luxury where it's comfort, convenience, all that stuff. And then there's the Ferrari version of luxury where you don't get a power locks or power AC. There's no air conditioning, there's no radio, but that's not why you buy a Ferrari, right? You buy it for performance, right? And so mine's much more.
This gas mileage is great.
Yeah, exactly, right? And so that's my version of concierge is that it's uncomfortable, it's very tough, right? We're going to dive into the deeper parts of your psychology. We're going to work on mental fitness. We're going to work on socialization. We're going to work on your VO2 max for actual longevity. You're going to be on the treadmill running. We're going to have targets. We're going to have strength targets, right? And we're going to really try and optimize that area of that rectangle that I described very intentionally and aggressively, right?
So a very holistic kind of approach is
very
kind of
much
what I'm
so.
hearing.
Yeah, very much so.
Okay.
Yeah.
Nice.
It's mental, physical, spiritual, all of the above. And yeah, it's sort of, yes, I leverage a lot of technology. Like I use AI to write the initial draft of my notes, which I then, rewrite, just so things aren't missed. I use, scripts. I code a little bit. So I've coded scripts to automate certain processes to track tasks for patients and so on and so forth. But also it's very high touch. It's like, hey, come in, let's talk about it. I mean, I've got a couple of patients, I've got different types of patients. Some of them come in just because they have a complex medical problem that they can't get anybody to spend enough time on to actually get it fixed, right? And now I'm not batting 1,000, no one does, but I got a couple of cool wins where, most recently, actually, I had a patient come in, fly in from out of state, and we kind of talked for an hour, and we realized that he might really benefit from a particular procedure. And so I did the procedure there in the office, and he had a lot of spots to work on, so it took me 2.5 hours, and so a total of 3 hours that we spent with the talking plus the procedure. And we kind of talked about it afterwards. It was just like, hey, if somebody has a problem that requires 3 hours of a physician's time, to be solved. Not that it's particularly intelligent, not that it's particularly brilliant. It just requires 3 hours of time. It'll just never be solved. You'll just go through life with that problem unsolved because there's no way to get 3 hours of a physician's time, right? And so, yeah, my practice is very much about kind of unrepentantly, absolutely being just what's best for the patient. Let's cut out all the other factors and holistically and completely think about what's best and then go from there, right? Now, the downside of that is I can't handle very many patients. I mentioned before that average family doc sees 2,500 to 50,000. I've currently got 18, and I think I probably will max out for myself at like 75, right? Now, at 50 or 30, I would probably hire another physician and start training them to in my ways. I would start teaching the secret sauce.
Absolutely.
But yeah, inevitably, that's another physician who's not seeing 3,000 patients and is seeing 50, right? And so there is a downside to that socially, which I'm aware of.
Do you work completely solo, or do you have like a PA?
No, completely solo right now. I hired a nurse for a little while, and she was really helpful. She was incredible. But, she helped refine the processes that I needed a nurse for. And then realistically, I was underpaying her from her point of view because I wasn't able to afford what she was really worth. And from my point of view, I was overpaying because I couldn't really use her as fully as I needed to use her. And so it was a great relationship there for a while. And then we parted on great terms. And I kind of went back to doing it solo with the assistance that she had defined what needed to be done for me very clearly in terms of the operationalization of the nearest things. But I put all my own IVs in. I draw my own blood. She helped me be a better IV placement person. So appreciate.
I hear
that.
a lot of people say that's tough.
There's a skill. There's a trick to it. I mean, there really is. Yeah. I mean, it helps to have somebody teach you the tips and tricks. I knew the basics of it. Like, I would do it in the hospital. Even before that, but I was pretty rough, and in the hospital you get away with that because you just need an IV, right? But somebody in the clinic's not going to be super happy with a very aggressive, like, let me stab into your vein and then like jam the IV.
Is this needle supposed to come out of the other side of my arm? Sorry,
don't mind.
Deep.
Don't mind that. It's fine. It's halfway through the vein. We'll pull back. It's fine. And so, yeah, I mean, she helped me kind of like be a little bit more graceful with it, a little more reliable with it, all the things, right? And so experience matters. But all told right now, so that was the longest possible answer to your question, actually. But the answer is yes. Right now it's solo.
It was a great answer.
Yeah.
Let me ask you, just an example. So I'm going to give you an issue that I had. And what made me want to ask this, because I wasn't going to ask this, you spend a lot of time with your patients. And so a couple things happened to me a few years ago. I had COVID. Mm-hmm. I had a tick embedded on me for, call it more than 72 hours, which in Pennsylvania, we have a really bad tick problem.
Sure.
I don't know how they are in Texas. They're not good here.
Yep.
And then you've got that tick is okay. And then you're like, yeah, you don't want that one on you.
Sure.
Okay. I had one of you don't want that one on you. I think you guys have the Lone Star ticks there actually, right?
Yep.
Which are not pleasant from what I understand. So I have COVID. I have the brain fog that everyone talks, the brain fog that still exists to this day. But the tick issue, they treated me. So they gave me the doxycycline, I believe it's called. They said, we're going to treat you as if you have it. I said, well, how do I know? Meh. Well,
yep.
We don't know. Okay, fair. So my word recall, my not short
down
term,
the fucking drain, man. It is
all over the place.
Shit.
I am all over the place. I'm mid sentence and I'm like, what was I saying? I could hang up this call and go, not that I would, but what was that guy's name again that we just talked to? Like, there's these weird things that I've known, and I've always I prided myself on my memory. People are like, how do you remember that? Well, that's starting to go away a little bit. And so I said this to my doctor the last time I saw him, which, by the way, I need blood work and a colonoscopy. So now maybe I'm going to pay you some money and come visit you to tell me what the real deal is. But when I told him because this is a concern of mine.
Sure.
you go bad places. You go, do I have dementia?
Yeah,
Do I
yeah,
have
yeah.
fucking brain
for sure.
cancer? Am I going to see my kids grow up? And I'm fucking terrified.
Totally.
Do you have Lyme
And
disease? Do you
yeah,
have,
do I have Lyme disease? Was it COVID? And his answer to me when I brought this up, and there was just a little bit of fear in me, my heart. I could feel it. And I just said, I need somebody to talk to, somebody that I can trust.
Yeah.
And his answer was, dude, you're in your 40s, man. Your memory starts to go. He gave me 5 seconds of his time. And I like the doctor. He's a great dude. But I wanted to go, fuck you. I deserve more than that.
Sure.
I deserve better than that. This is a concern of mine. Don't tell me I'm 40 because you may have a medical degree, but I know my brain.
Yep.
And my brain, in a very distinct period of time, started to go downhill a little bit.
Sure.
And I need better answers. Tell me you don't know.
Sure.
Tell me you'll look into it. But to just go, you're 45 years old, it happens. Didn't sit, it's still, if you can't tell, does not sit well with me. What do you do? I mean, what do you do with something like that?
Yeah.
Because again, do I get blood work done? Do I find out things? Like, I don't know where to start if that's where my doctor is going to lead me.
Yeah, so there's a couple of things there, right? Is brain fog is fundamentally challenging, and both patients and doctors need to realize it's difficult, right? And one of the reasons is it's difficult to get objective data. So the first step for me is trying to get whatever objective data I can. So there's an online service I use, but there's tons of other ones. I try to get quantification of memory, quantification of reaction time, quantification of, okay, let's take executive function, whatever the deal is. So there's a bunch of different tests you can do to try to get some measurements of different aspects of brain function, right? None of them are perfect.
Okay.
None of them are great by themselves. Hopefully together we get something there, right? And then we try to see, okay, well, what can we do to try to improve this? And I'm working actually with a couple of patients, one of whom actually they're both doing kind of well. One of them did well enough that she actually quit the practice. So I guess that says something. Nobody really knows why the brain fog happens. There's no real answer there. So it's very difficult to figure out what to do about it. For Lyme disease, if you were already treated, the problem with Lyme disease and the reason people didn't test is the tests are not super accurate. We just don't have fundamentally a really reliable test to the point that if somebody comes in and says, hey, I got bit by a tick and I'm having whatever, whether it's brain fog or it's rash or it's if the test said you don't have Lyme disease, I'm still going to treat you. If it says you have Lyme disease, I'm going to treat you. So why would I even bother doing the test, right?
Right.
Because it's wrong too often to be reliable. So there's a very few sort of edge cases where I might actually do testing where, well, I don't know if it was a tick or I wasn't in the right area, but maybe, or I was on the edge of where the areas were, there might be circumstances where the test might help you try and make a decision, but not something you'd really want to hang your hat on in either direction.
Okay.
Right. So that's the first thing. The second thing is, the few patients I've had who seem to do better, it was an exercise-based protocol. And so both of them had pretty severe symptoms. So brain fog, yes, but also post-exertional malaise. So after they would try and go for a run, which they were both athletes, which is why they came to me, because they were disturbed by their complete wreckage after trying to go for a pretty simple run. And they're yeah, for one, it started pre-COVID. It was a different virus. They never found out what in 2016. And so she came to me and was like, hey, it's been 8 years. And I can't run. And then another one, it was 8 months or something, whatever. And so for both of them, the core concept was finding a level of activity that was low enough that their body could adapt to. And because they were both athletes, they kept trying to do too much. And so part of the thing was doing a metabolic test. So it's a VO2 max test, but you get a ton of metabolic data. For this purpose, I'm actually more concerned with the low end of the data. So not the maximum, but actually from zero effort up to about 60 or 70% effort. That's where the rich data is to see what the mitochondrial function is. And the mitochondrial function in the muscle maybe reflects the mitochondrial function in the brain after a viral illness, right? And so I use that as a proxy, and I try to optimize the mitochondrial function in their muscle by giving them an exercise program that is very low energy but consistent. So it's like you start with 30 minutes at a speed where it's so slow you want to blow your brains out. And then you go 40 minutes, 45, 50, 55, 60 minutes, again, still at this insanely painful, boring speed. Get up to there for about 4 weeks. Also part of that program is an insanely easy weightlifting process. So you go through different muscles. You lift basically until the first rep that you can tell is a little slower. So the first rep where, actually I couldn't get that one up as fast, and then you're done. That's your last rep, right?
That's an interesting one.
And then after 4 weeks of that, I retested. She did show improvement, and so we added on 1 day. She replaced the low intensity walk with a HIIT session of intervals, right? So that's a protocol.
Which is not low intensity.
Not low intensity at all, right? But it's once a week. She continues with the low intensity the rest of the week, and it's 6 days a week, by the way. So this low intensity 60 minutes is 6 days a week. So insanely time consuming, right? But she's nailed it, man. She's really nailed it, and she is feeling better, and she's moving on. She's doing great.
Good for her.
The other patient, oddly enough, that's based on a paper, by the way, that came out after the other patient had already gotten better and quit. But she actually, we kind of worked together, and she found her own solution on a forum, which was to take a quarter tablet of ibuprofen before a workout. And what's interesting is that one tablet of ibuprofen didn't work, and no tablets of ibuprofen didn't work, but a quarter tablet worked. Now, could that be placebo? Could that be whatever? Sure. Or, again, theorizing, speculating randomly in the midst of no data, it limited the inflammation enough to not wreck her, but also allowed some inflammation so that her body had something to adapt to, right? And I think finding that rhythm can be important, right? Now, if you're not having the wreckage symptoms after physical exertion, maybe your preferred level of adaptation is going to be higher than what I'm describing, right? But there's a reasonable amount of data that lactic acid works in the brain to improve a variety of brain functions. And so that would be my starting point is, if you came to my clinic, I would put you on the treadmill with the metabolic analysis mask on. By the way, you can do that yourself. Actually, now it's $500. It's actually not totally out of reach. Caliber Bio.
Oh, cool.
So I'll put a plug in for them. The great guys over there.
Oh, please. Yeah, that's great.
And
I have a treadmill. So,
so
that's good.
You just set a program where you're walking insanely, painfully slow, get yourself warmed up, and then basically increase the speed by, again, if I don't have you in front of me to do an individualist protocol, I would just say increase the speed by 0.5 every minute until you literally just can't go anymore. And then look at your data on this app from this mask device and see where the it'll tell you your VO2 peak, your VO2 max, and pick 40% of that. So whatever speed you were going that was giving you 40% of that VO2 peak, that's the speed to start at for this. And so
very cool.
Yeah, anyway, I mean, the brain fog is difficult, right? And again, then you would need an objective measure to say, okay, cool, we're going to do this for 4, 8, 12 weeks, and then we'll retest your brain function and see if there's any objective improvement. And if there is, then we can keep on. And if there's not, then maybe you need to do something else. Maybe it's a quarter tab of ibuprofen. Maybe, again, lactic acid. Maybe you just need to do exercises that maximize lactic acid production. So you just need to be doing wall sits every day just to get that burn in as many muscles as possible and get that lactic acid flowing. Maybe that's the right solution for you. So again, it's a matter of training. The other thing I will say while I'm wrapping on the subject of brain function, right, is novelty actually seems to trigger global plasticity in the brain. And so the other notion would be to say, hey, if you've never played a musical instrument, maybe now's the time to pick one up. If you've never learned another language, maybe something you've never forced your brain to do, and dedicate a lot of time to doing something completely novel would trigger plasticity. And the last thing that triggers brain plasticity is psychedelics. And so that's the back pocket thing you might try is psilocybin.
Start taking acid,
LSD.
Mike. Let's do it. LSD.
That's mushrooms, buddy.
And
Mushrooms.
so there you go. Yeah.
I'm not touching that other
MGMT.
stuff.
Yeah.
I may have had a chocolate bar once. I don't know. I can't confirm or deny that, but that definitely increases brain function.
Yeah.
That is something I 100% believe in.
Just go straight for the DMT. You know what I mean? just
That's right.
I do have a guitar. I bought a bass guitar. I bought a bass guitar recently, and just to keep anything I can do. This has been fun for me. This has gotten the brain working in different ways. The bass guitar, just a few things. Just trying to be different. But one that I've always wondered is I live in Pittsburgh. It is always gray, and with me working from home, am I getting enough vitamin D? There's so many things that I know that I need to start to explore.
Sure.
Just again, things I can control.
Yep.
And so I can rule certain things out. So
Vitamin D is an interesting one that
tell you about vitamin D.
That's
Don't get
right.
enough of it.
That's right.
I haven't had a doctor for years, and I just went and I started seeing a new doctor. I really like him. He's a lot like you in the way that he bucks against the natural way of, or the not natural, but the very common medicine practices right now. And our first conversation I had of them was great. He told me, like, the first thing we wanted when we find a problem, the first step is, can we do a behavioral change? The second step is there a surgery or something that will correct this long term? He goes, my last resort is putting you on long-term medicine. I don't want you to be on medicine long-term. So going to that stuff, but then one of the first things we dealt was blood work, and he goes, yeah, your vitamin D is trash.
Sure.
And he goes, so you're going to take a 5,000 milligram a day. And he goes, and then once a week until we can get your levels back up to normal, you're going to take a 50,000 milligram per day.
Sure.
He goes, because it's just, there's not enough sunlight. You're never going to get the amount of vitamin D you need. That's just, and me moving from California, this was something weird to me because I came from the Sunshine State. Like,
Vitamin D is interesting, we definitely, actually, it's a great time to go back and re-illustrate kind of what we talked about before, the notion. So epidemiologic studies, non-randomized placebo-controlled trials show that people with low vitamin D levels do have increased risk of heart attacks, do have increased risk of death, do have increased, all the things, right? However, placebo-controlled trials where they replace people's vitamin D does not seem to reduce the risk. Right. And so one of the things you start to wonder is maybe the benefit is in the sunlight, not in the vitamin D. Right.
Yeah.
And so that's an odd thing where it's like, well, the vitamin D is just a marker of whether you're getting enough sun. Maybe. And again, maybe it's the light, right? Maybe it's the light itself. And so irrespective of what it does to your vitamin D, right? We don't know. And there would be additional trials needed to figure out whether low vitamin D was a real true risk factor independent of the light effect. But at least the few that we have, there's some reasonable questions that it's not the vitamin D. That just happens to be a marker of how much, for some people, but not all people, like how much sunlight they got.
Well, I've heard a lot of people that have bought these lights.
Yeah.
Because it is.
Exactly
we have a very distinct gray. I'm looking out the window. It is called Pittsburgh gray and should be in the next box of Crayola. It's very unique. But you can tell there's like seasonal depression in a way where you're not getting enough sunlight. And then when you get sun, I like to golf. I'm outside all the time. Love you doing yard work, love gardening, plants, things like that, anything. And it's when I'm not able to do those things, you can feel a little bit of a difference. And so that's a very interesting take on that. Awesome.
All right. Well, I do want to jump back to River Rock Medical for a second.
Yeah.
Your practice, you also have a YouTube channel. So I just want to wrap this up a little bit, and I want to have you, I want you to plug in for us where people can find you. Where can they find your practice? Where can they find your YouTube content? where can they find you?
Sure. So my YouTube channel is, of course, youtube.com/@riverrockmedical. My practice is riverrockmedical.com. If you're interested, you can sign up for your first visit there, or sign up for just a free sales call. Reach out, book an appointment for a 15-minute phone discussion. Just see if it's a right fit. If somebody's interested in that, I am on Twitter, rarely, on occasion. So it's not
So are we.
Yeah, not a reliable mechanism, but if you wanted to see some ideas, you could at drhakeem.com or at Dr. Hakeem on Twitter. And I'm not, I have an Instagram account at River Rock Medical, but if you reach out to me there, it might be months before I get back to you. So the website and the YouTube channel are definitely the better option.
Excellent.
Nice.
Yeah. I think we're
and
the
we will
opposite,
happily plug all
where
those. Yeah.
We will get on Instagram every once in a while, and if you message us on Twitter/X, whatever they want to call it now, it is going to be months before I see that to you back. I avoid the cesspool that is X.
Correct. It's truly awful, and so despite my need to market my practice, even then, I'm like, should I let the practice fail or market myself on X? It's 50-50. I don't know.
They're like, all publicity is good. I'm like, I don't know. Have you been on X?
Yeah.
Exactly. No, that is awesome. Thank you for that, and I appreciate it. Thank you for coming on the show. I had so much fun with this conversation. I probably didn't say
absolutely.
a lot, but I was sitting back here listening to you talk and just like, yes, nodding my head constantly. But the people who are listening aren't going to see my head nod, but
awesome.
I loved our conversation today, and thank you so much for coming on and having it with us. I appreciate that.
Thanks for having me. No, it's a blast. Yeah, I enjoyed it.
Dude, I think I'll leave it with this. I think when I came across, and because I saw you at first, this is the guy the world needs. And I mean that from the bottom of my heart. The people that do what you do, and listen, you got to buck the system sometimes to see real change. I think medicine is a good place to start. I think when you feel in your heart that a doctor cares about you and is thinking outside of the box to try to make people better, right? Yep. Don't keep them sick, make them better in any little thing that you can do. That's what my wife's thing is. How can I make you feel better? What can we do? And you see results with that. So, I can tell you that we appreciate you. It's been a blast. I'm so happy you came on. And if we get a couple people to listen to this and go, you know what, I'm going to try something different, I think that's what it's all about.
Absolutely.
So you're awesome, man.
Thank you guys, and have a great rest of your day. Cheers to you both. My drink is empty.
Cheers, buddy.
Doctor,
mine's gone.
Is your protein drink gone?
It's gone. Yeah, that's been consumed. So,
all right.
Nice. Well, good chat with everyone.
Have a great day.
You too.
All right, we'll see you guys. Bye.
You're leading me astray over hills and mountains and to America. You're sweeter, stronger, decenter, you're spunkier nor tay. Oh, whiskey, you're me darling drunker soul.